It incorporates everything I love to do. I love to work with people, I like the science, I like the medicine, and I'm the happiest helping people. And we look at a patient in the whole sense, from the head to the toe, so we're not just looking at a body part. We incorporate maybe how they're sleeping, their biomechanics, our other body parts going wrong that may be contributing to the fact that they're not healing as well. And I do non-operative musculoskeletal care. We're trying to get the patient to function at their maximum capacity with whatever disability or injuries they've had, and hopefully get them back to full function. I think you can find out a lot of information if you just listen to your patient. A lot of the diagnosis can be made by the history, the symptoms, and hearing what they have to say. What my style is to get you better may not be their style. And you have to work with this, because even though I may be able to tell you what to do, if you're not going to do it, it's not going to help you at all. So we've got to find a match that works for the patient, because ultimately I'm okay. It's my patient I have to help. And there's some different types of patients I see. I do chronic pain management, so those patients are a little different, where we do a lot of background history, what's been going on, what's been led them to this. Do they really need chronic pain management? What has or hasn't worked? If I get a typical patient of more newer injury, how did it happen? What's the complications keeping them from functioning? What's interfering from them being able to do what they want to do, as in from their activities, whether it's sports, whether it's going out to dinner with their family. And then we'll look at what treatments they've tried. And I use a variety of treatments, from chiropractic care to acupuncture to meditation to massage therapy. So I'll encompass almost any type of treatment if I think it's going to benefit my patient to get them back to where they want to be and function. I have several patients that I've done chronic pain management with that I treat because they've had multiple surgeries that have failed, complicated by infections. Nobody's really been able to help them. And those are pain management patients that they've told me, and they thank me, that I've given back their quality of life. Staying active is my big motto to my patients. I talk to them about, I do a lot of arthritis, which, as we know, there's no cure. We can give new joints, but there's only so many new joints, and most people are not real excited to get a new joint. But I tell them they're like a rusty car. If you don't keep moving, it gets stiffer and stiffer. And it's real hard with arthritis, because the less you move, the stiffer you get, the more pain you have, the less you move, the stiffer you get. So you're in this downward spiral. And those people with a lot of these conditions, as hard as it is for them to keep on moving, if they do keep on moving, they do much better. So staying active is the key, and finding things they love to do is really the key. I'm really flexible with exercise programs, because if they don't enjoy it, they're not going to be able to stick with it. I'm always, with pain patients, always looking for new things that may help my patients. Because I have patients that, sometimes we don't know why they have pain. Nobody can pinpoint it, nobody can see it on an MRI, on a CT scan, and they still have pain that's affecting their ability to function. So we're always looking, whether it's from meditation, new laser treatments, there's prolotherapy, there's some new studies with platelets that they're using, new types of interventional injections. I do send people out to different specialties to control pain, and always looking at new diagnostic options, new fronts I treat a lot of fibromyalgia, which is a chronic pain condition. So I'm always looking at new treatments for that. So I'm always looking, or even in the holistic field, whether there's new types of acupuncture or massage therapy, or I use a lot of creams because a lot of my patients are very sensitive to oral meds. So trying to find other types of treatments that can benefit my patients. It's always a search. I always want to have that tool bag very full of things that I can help my patient. But usually with a lot of education, you can help your patient still, no matter what their background is, get them to functioning and get them the help they need so they have a good quality of life. Really, my specialty looks at quality of life as the ultimate importance for my patients.